This is WEGOVY, a drug approved in 2021 for the treatment of unhealthy weight. It has now become one of the trendiest weight loss drugs praised by Hollywood celebrities, tech moguls, and numerous TikTok users. On social media, these drugs are often portrayed with overwhelming positivity as a quick fix solution to dropping some extra pounds. In this video, we'll talk about the dark side of these weight loss drugs. WEGOVY and its sister drug Ozempic are both brand names for the same generic drug, Semaglutide. Both WEGOVY and Ozempic cause weight loss, though Ozempic is primarily used in patients with diabetes to control their blood sugars and decrease the risk of heart disease. These drugs are being used more and more by healthy individuals with normal weight wanting to quickly shed a few pounds, and using these medications can come with serious consequences. The first thing to know about WEGOVY and Ozempic is that, like all medications, they come with side effects. In the 2021 research study that got WEGOVY its FDA approval, about 10% of participants experienced serious side effects, including nausea, diarrhea, vomiting, headache, constipation, and belly pain, which caused the majority of these individuals to go off the medication. A drug that causes nausea, diarrhea, and vomiting? No wonder you lose weight. There were also rare but serious side effects like pancreatitis, gallbladder disease, kidney disease, fast heart rate, and increased depression with suicidal thoughts. These drugs also have an FDA black box warning for the potential to increase your risk of thyroid cancer. Although for most people the side effects are typically mild, these drugs are definitely not without risk. It's also important to know that WEGOVY and Ozempic are meant to be taken forever. Forever as in the rest of your life. If you stop these drugs, you'll get rebound weight gain. Take a look here to see what happened when people went off of this drug. Even though patients lost 17% of their body weight after 68 weeks, they regained about 2/3 of that weight within 1 year of coming off the medication. That means getting onto this medication is a lifelong commitment and should be done in partnership with a healthcare professional and alongside creating habits that will keep the weight off. You can bet the makers of this drug, Novo Nordisk, are very aware that getting on these medications is a lifelong commitment. WEGOVY costs about $1,600 per month without insurance, and Ozempic is about $1,200 per month. For many folks with a healthy weight, insurance will not cover this medication. I found a coupon code online for a $25 Ozempic prescription, and I thought it was interesting that the price is only good for 24 months, since these drugs are meant to be taken forever and we all know what would happen to your weight after going off of it. It's no surprise that Ozempic is Novo Nordisk's top-selling product, bringing in over $3 billion in sales in 2021. The company's stock prices have never been higher, even at a time when the global economy is slowing down. Finally, there's the issue of supply shortage. With so much attention on social media about the promise of weight loss, the use of WEGOVY and Ozempic is increasing rapidly in people who have normal weight. This type of use is off-label and not recommended unless done under close guidance by a medical professional. With the increase of people using these drugs for weight loss and often paying exorbitantly high costs, the supply simply can't keep up with demand. That also means that patients who really need these medications are not able to get them easily. Some patients with diabetes who have been on these medications for years are having to go to multiple pharmacies before finding enough of the medication, or being forced to take a smaller dose than usual, or even switching to alternative medications like insulin, which may not be as effective at controlling their disease. WEGOVY and Ozempic are super popular weight loss drugs because they work well most of the time. These drugs mimic a hormone called GLP-1 that targets areas of the brain that regulate appetite and food intake. The meds also delay emptying food from the stomach, which can help you feel full for longer. Many people who have taken them swear by their benefits, and their weight loss proves it. The issue is that these drugs are studied and intended to be used in patients who have an unhealthy weight and as part of a longer-term weight management plan that also includes healthy eating, plenty of exercise, and addressing other underlying medical conditions. They're not miracle drugs and haven't been studied in people with normal weight who may experience unintended side effects. If you're thinking about starting one of these drugs for weight loss, please check in with your doctor first and know the risks involved. Thanks for watching.